Hello, I'm Vanessa. Today I'm going to talk to you about airway management. When we're talking about airway management, you want to make sure that your patient is positioned correctly so they get maximum airway. Make sure their head is tilted back if need be. There are several things you can use to help the patient with their airway. One is an oral pharyngeal airway. The other is a nasal pharyngeal airway. In the oral pharyngeal airway, you only want to use this on unconscious patients. You do have to measure to make sure you have the appropriate size. To measure, you would measure from the corner of the mouth to the end of the mandible. And that way you know you have the appropriate size. When inserting, be mindful if the patient has caries or broken teeth, because it could cause further damage. When we're putting the airway in, we're going from the side, then we're going to flip. The airway is designed to hold the tongue back and away, so they have an open airway. This is only used on unconscious patients. Then we have the nasopharyngeal airway. Again, the nasopharyngeal airway can be used on patients who are conscious or semi-conscious. You do have to lubricate the tip with water-soluble gel. To measure it, you would measure from the tip of the nose to the earlobe. Tip of the nose to the end of the earlobe. When you're inserting it, you do want to insert bevel side up. And turn. If you meet any resistance, you can turn. If there's still further resistance, just go ahead and take it out and try the other nares. So once you have the nasopharyngeal airway in, from this airway, you can suction. You can also ventilate. And when you're using this airway, of course, if the patient would have any deviated septum or any injuries of that such, you would not use this. There's also a different type if the physician wants to intubate the patient. When you're assisting with intubation, you would need to gather some supplies. You would need an ET tube. The physician will tell you the size. You'll need a stylet, 10 cc syringe, CO2 detector, and some lubrication. The stylet goes inside of the ET tube to help shape it to give the physician something harder to work with. In our policy, just like with the Foley catheters, we do not inflate this balloon. This balloon is not inflated. You'll hand the physician his supplies. After it's inserted, you're going to use the CO2 detector to make sure it is in the right place. The physician will order an x-ray, again, to confirm the placement. They will listen to breath sounds, order a chest x-ray to make sure the tube is in the correct place.